we have Dr. TEREZA KASAEVA, who is our director here at WHO of the Global TB program. We have Dr. Alma Golden, who is assistant administrator of USAID's Bureau of Health. With us also is Dr. Peter Sands. He's executive director of the Global Fund. And we also have Ms. Evelyn Kibuchi, who is a TB advocate and WHO Civil Society Task Force and Stop TB Kenya. We also have with us online as our colleagues who may answer some specific technical questions, Dr. Philippe Glaziou, who is in TB Monitoring and Evaluation Unit, and Dr. Matteo Zignon, who is a unit head, Unit for Prevention, Care and Innovation. So we will start with the opening remarks, and then we will open the floor for questions. I will remind you that you will have to press click raise hand to be put in a queue for questions. And immediately I will give a floor to Dr. TEREZA KASAEVA for her opening remarks.
Dear colleagues, ladies and gentlemen, it's an honor to join Dr. Alma Golden, Assistant Administrator for Global Health of the U.S. Agency for International Development, Mr. Peter Sands, Executive Director of the Global Fund, and Ms. Evelyn Kibuchi, a TB advocate, member of WHO Civil Society Task Force on TB, in launching today the World Health Organization's 2020 Global Tuberculosis Report. On behalf of the World Health Organization, I would like to start by thanking countries, civil society, partners, especially US government, Global Fund, Stop TB Partnership, who are contributing to the fight to end TB, as well as our colleagues from WHO regional and country offices for your dedicated hard work to save people's lives. TB remains the world's top infectious killer, claiming close to 4,000 lives a day and 1.4 million lives annually. It is the leading killer of people with HIV and a major contributor of antimicrobial resistance related death. 10 million people fell ill with TB worldwide in 2019, including 5.6 million men, 3.2 million women, and 1.2 million children. Among all those affected, 8.2% were people living with HIV. This preventable and curable disease places an enormous human and societal toll on those affected, their families and communities. To accelerate the response to TB 2 years ago, heads of states and other leaders from around the world gathered for the first ever UN high-level meeting on tuberculosis and made bold commitments. These commitments have offered hope for ending the death and suffering of millions worldwide who are struggling with TB. 2020 marks a midpoint of efforts to accelerate the TB response to reach the 2022 targets. This year, Global TB Report showcases global, regional, and country progress, while highlighting that much remains to be done to reach the TB targets. It also complements and expands on the UN as Secretary General's 2020 Progress Report on TB. It shows also the impact of COVID-19 pandemic and that it threatens to unwind our gains. Let me give you a quick snapshot of findings based on data coming from virtually all countries worldwide. Let me acknowledge that there has been significant impact with the work done to date in reaching and providing prevention and care to people with TB. Around 60 million lives has been saved since the year 2000. There was a 9% reduction in TB incidence between 2015 and 2019, and 14% drop in deaths in the same period. More positively, WHO European region has almost reached the 2020 milestone for reductions in incidence and death, and the African region has made very good progress. A total of 78 countries are on track to reach the 2020 milestones for reductions in incidence, including 7 high TB burden countries that have already reached it: Cambodia, Ethiopia, Kenya, Namibia, Russian Federation, South Africa, and the United Republic of Tanzania. More people received life-saving treatment for tuberculosis in 2019 than ever before, largely due to improved detection and diagnosis. Globally, 7.1 million people were diagnosed and treated for TB, up from 6.4 million in 2017. And in cumulative term, 14.1 million people were treated for TB for the last 2 years. This is over a third of way towards the 5-year target of 40 million. Progress in reaching so-called missing people with TB has been also driven by the flagship initiative of the WHO Director General, Find, Treat, All to End TB, jointly with the Stop TB Partnership and Global Fund. Strategic initiative of Global Fund focused on 13 high TB burden countries and through the work of USAID in priority countries. Progress in expanding access to TB preventive treatment has been slower. Around 6.3 million people started TB preventive treatment in 2018 and 19, about 1/5 of the way towards the 5-year target of 30 million. Although drug-resistant TB remains a public health crisis, there was some progress in testing, detection, and treatment of drug-resistant TB for the last year. Globally, in 2019, 61% of people with bacteriologically confirmed TB were tested for rifampicin resistant, up from 51% in 2017 and 7% in 2012. Coverage of testing was 59% for new and 81% for previously treated TB patients. A globally total of more than 200,000 people with drug-resistant TB, of the 500,000 people with drug-resistant TB estimated were detected and notified last year, a 10% increase from the 2018, and more than 177,000 people were enrolled in treatment. Unfortunately, the cascade is still negative. According to the results of a national survey of costs faced by patients and their households, 49% of people with TB and their households faced catastrophic costs. For people with drug-resistant TB, this figure was higher. Funding remains a major issue. In 2020, funding for TB prevention, diagnosis, treatment, and care reached globally 6.5 billion. Only half of the our 13 billion US dollar target agreed by world's leaders during the high-level meeting on TB. As in previous years, most available TB funding, 85%, came from domestic sources, with Brazil, Russian Federation, India, China, and South Africa providing 57% of the global total. International donor funding remains important, especially for low-income countries. The Global Fund to fight AIDS, TB, and malaria was the single largest source of international TB financing in 2020, as it was before. While the United States remains the biggest bilateral fund of efforts to end TB. There have been intensified efforts on research and innovation to drive the development of affordable and accessible rapid tests, as well as new, safer, and more effective treatment and vaccines. Member states called on WHO to develop a global strategy for TB research and innovation. It was developed and adopted by the World Health Assembly in August 2020. Further progress towards ending TB will depend on actions across sector, I mean multi-sectoral engagement and actions, and here role of the civil society, partners, and other sector engagement of other sectors of economic is even increasing in the current situation. COVID pandemic threatens to undermine our gains. In many countries, human, financial, and other resources have been reallocated from TB to COVID response. Data collection and reporting systems have also been negatively impacted. According to the new report, and data collected from over 200 countries shown significant reduction in TB notifications, with 25–30% drops reported in 3 highest TB burden countries, India, Indonesia, and Philippines for the last 6 months. This reduction in notification could lead to a dramatic increase in additional TB deaths, according to WHO modeling. On a positive note, in line with the WHO guidance, many countries have taken measures to mitigate the impact of COVID on essential TB services, including by strengthening infection control. A total of 108 countries, including 21 countries with high TB burden, have expanded the use of digital technologies to provide remote advice and support. To reduce the need to visit health facilities, many countries are providing home-based treatment with the necessary adequate drug supplies at home. All these efforts are vital to strengthen health system, ensure health for all, and save lives. To put the world on track to reach agreed targets by 2022 and beyond, and reduce the enormous human and societal toll caused by TB, Member States are urged to implement 10 priority recommendations and as outlined in the 2020 progress report to the UN General Assembly. And first of all, fully activate high-level leadership to urgently reduce TB deaths and drive multi-sectoral actions to end TB. Urgently increase funding for essential TB services, including for health workforce. Advance universal health coverage to ensure all people with TB have access to the diagnosis and treatment. Address drug-resistant TB crisis. Dramatically scale up provision of TB preventive treatment. Promote human rights and combat stigma and discrimination. Provide meaningful engagement of civil society in all our activities. Substantially increase investments in TB research to drive technological breakthroughs and rapid uptake of innovations. And it's possible even in this situation. And we just have 2 years to go to reach the targets and keep the promises made at the UN high-level meeting on TB. These priority actions can help drive the response. As a precursor to the coming 2 critical years, this year's global report offers the opportunity to critically analyze progress and challenges, review and optimize programs, strengthen surveillance system, and move from rhetoric to actions. 2020 is a critical year for all of us. While we struggle to overcome the COVID pandemic together, we should not neglect the millions of people suffering and dying from TB. All lives matter. WHO will stand by every country, partner, civil society, or person that decides TB, COVID, or any disease has no place in its future. It's time for urgent action. Thank you.
Thank you very much, Dr. KASAEVA, on these opening remarks and outlining the key aspects of the Global TB report. I will now invite Dr. Alma Golden, who is from the USAID's Bureau for Global Health, to put forward a few remarks. Dr. Golden, please.
Thank you. Thank you very much for the kind introduction. Good morning, good afternoon, and good evening to all my distinguished colleagues on the panel and to all of you participating around the world. Your commitment and compassion are inspiring. While COVID-19 has had a devastating global impact over the past 9 months, TB has been silently killing millions of people for years, in fact, for centuries. As Dr. KASAEVA noted, in 2019 alone, TB sickened an estimated 10 million people and took the lives of 1.4 million. The United States Agency for International Development is proud to have supported the development of the TB Global Report for the past 20 years. The availability and use of quality data is very important to our agency. We'd like to thank WHO for their dedication and commitment for the timely production of this report, especially considering the challenges this year due to COVID-19. With USAID as the largest bilateral donor leading the international TB response, the US government is committed to ending TB. The WHO TB report is an example of USAID's commitment to ensuring a data-driven approach. We've seen the power of this data to stimulate more robust and tailored responses at both national and global levels. With this year's report, we see progress in case notification and treatment coverage, particularly with multi-drug resistant TB, for which we're very grateful. Globally, we must accelerate if we're going to meet the ambitious targets that were set at the United Nations high-level meeting on TB, just as Dr. KASAEVA said. Additionally, we all know that since this data collection, the landscape has actually changed. COVID-19 and its mitigation efforts are impacting TB services and could cause further delays in achieving our global targets. While many other diseases are impacted by the effects of COVID-19, TB carries an additional complexity, sort of a snowball effect, because untreated cases create dangers of increased development of drug resistant, additional spread, risk of other comorbidities with COVID-19, and also it has the stigma of similar symptoms to what are seen with COVID-19. As many of you know, a recent modeling study commissioned by the Stop TB Partnership and supported by USAID cites that 5 to 8 years of progress could be lost, with an additional 1.4 million TB deaths projected between 2020 and 2025. Given this prospect, USAID is eager to do our part in helping the world get back on track quickly, and then rapidly accelerating progress toward the target set at the 2018 United Nations high-level meeting on TB. We must ensure that by 2022, the 40 million people that are in need of TB treatment are receiving it. With the right approach and working together with partners, we can achieve it. Together, we believe that the approach USAID has launched 2 years ago with the Global Accelerator to End TB paves the right road forward. The accelerator is a business model, and it's designed to increase investments from the public and private sector. The accelerator empowers local communities and partners to deliver locally generated solutions to deliver performance-based results. The accelerator remains increasingly relevant now because it strengthens local institutions and it promotes systemic change in the health sector, and both are critical to countries maintaining progress to date, especially addressing TB. One example is Uganda. After Uganda's TB prevalence survey showed more cases than previously estimated, USAID and the government of Uganda developed an implementation plan with commitments by both parties to address the issue. Working hand in hand with the country's national TB and leprosy program, this joint effort contributed to a significant increase in TB case detection from 60% in 2018 to 80% in 2019. The accelerator's approach prioritizes building strong and sustainable local institutions, as I said. These are on the ground and more readily available to help the countries and the patients with the TB response. These local partners have been particularly important in supporting continuation of TB services during the COVID-19 pandemic, when countries and many of their health facilities and other institutions were shut down. For example, in Nigeria, when restrictions on movement made it difficult for many TB patients to continue treatment, USAID's local partner and Sano State introduced a series of interventions, and they included providing infection control materials, building provider capacity to host virtual meetings, and also monitor TB service delivery data in real time using a mobile app. In addition, they worked with the state TB and leprosy control program to avoid drug stockouts. These strategies actually resulted in a surge in TB case findings in April, and when the area was first impacted the previous month. And in Burma, when COVID-19 impacted mobile TB case finding activities, USAID's local partner was able to integrate TB screenings in the Ministry of Health and Sports community fever clinics. With this challenge facing the world, the accelerator's approach to increase coordination, leverage additional resources, and develop effective interventions is more important than ever. We cannot continue business as usual. It's critical to innovate and adapt our programs to aggressively address TB. More than ever, we need to be vigilant in our response to TB and support a comprehensive approach that includes clinical and operational research, the rapid adoption of new tools and approaches, supportive care and treatment, and diligent reporting so that we can adapt our response to this epidemic as it continues to change. The annual Global TB Report plays an essential role in this effort, and we welcome this year's publication and congratulate you on this event today. Many thanks. Over.
Thank you very much, Dr. Golden, for these words and for your support to the global fight against TB. I will now give floor to Mr. Peter Sands, Executive Director of Global Fund. Mr. Sands, can you hear us?
Good afternoon and good morning, everyone. The Global Fund welcomes the annual Global TB report of WHO. It's quite a sobering report and an opportunity to reflect both on the progress made, but also the challenges we face, and also to discuss what we need to do to get on track towards the ambition of ending TB as an epidemic by 2030. The Global Fund is, as TEREZA said, the largest international funder of TB prevention, treatment, diagnostic programs, and has invested, as of June 2020, $7.2 billion in programs across the world to prevent and treat TB. With the success of the replenishment conference last October, we are in a position to increase TB funding by 23% as of January 21, and will be investing around 800 million a year in TB prevention and treatment, working with countries and civil society in the private sector, and of course, partners such as WHO, USAID, Stop TB, and driving towards the targets set at the UN high-level meeting and End TB. I think the key message we need to take from the WHO's Global TB report is a couple of sobering ones. First, that we were not on track even before COVID hit. And second, that COVID is going to make getting back on track even harder. There has been progress, certainly in the countries in which the Global Fund invests. TB deaths have dropped by 25% since 2002. But still, far too many people die of TB, 1.4 million, and the gap between those that fall ill and those that are diagnosed and treated is far too great. And as TEREZA said, we are way behind on TB prevention. COVID-19 has made this even more challenging. We have seen widespread disruption of programs. The Global Fund surveys programs in more than 100 countries, and roughly 75% of them are experiencing significant to moderate disruption. This has been particularly the case with programs to identify missing people with TB. And we've seen, as TEREZA mentioned as well, reductions in TB case notification in the range of sort of 25–30% in many countries. We've also seen the diversion of resources. Many of the people who lead TB programs are experts in respiratory infections and have also been driven towards responding to the COVID-19 crisis. Very, very understandably, they're often the leaders of the COVID-19 response. We've seen instruments used for TB diagnosis being repurposed and used for COVID-19. Powerful molecular diagnostic tools a good use of them, but also putting pressure on TB diagnosis. And looking forward, because TB is so dependent on domestic resourcing, with 85% of the resourcing coming from governments themselves, the impact, the economic impact on countries, on their fiscal resources and capacity, and thus on their ability to fund TB programs, has to be a source of concern. And then lastly, I would mention the impact of COVID on human rights related barriers to accessing health services. TB affects most populations that are often marginalized, the poorest, discriminated against, and often suffering significant stigma. COVID-19 has in many countries actually fueled these challenges, making it even more difficult to reach the people with TB and even more difficult for those with TB to access services. In response to these challenges, the Global Fund quickly made available about $1 billion for helping countries adapt their HIV, TB, and malaria programs to COVID and to support the COVID-19 responses itself. We've been working with our partners in the TB community, WHO, USAID, Stop TB, civil society partners, to address all the challenges and to drive the kinds of innovations that Dr. Alma was talking about, Dr. Golden was talking about. So multi-month dispensing, use of digital tools, creative partnerships with the civil society to try and address some of these issues. But I think we have to be very realistic. We have been knocked backwards by COVID-19 in the fight against TB. We have worked very hard to mitigate that damage, but there has been damage. And collectively, we need to not just get back on track from where we thought we would be, but we need to catch up the losses that have been made this year. And I'll close just with some reflections on what I think we should learn in the context of COVID when thinking about COVID-19 and TB together. The first is that we do not want to repeat with COVID-19 what we have done with tuberculosis. TB was once a global pandemic, but the reality is that when TB became less of a threat to wealthier communities, people in rich countries, and was only killing millions, and I say only, only killing millions in the poorest and most vulnerable communities, the money dried up and the political visibility fell sharply. We cannot do this again with COVID-19. We cannot leave people behind in the fight against COVID-19. In fact, we should do the opposite. We should use the global ambition of saving everyone from COVID-19 and protecting everyone from the new pandemic to raise our ambition for TB, because that's exactly what we should also be doing with TB. And we should also reflect on the relative commitment of resources and ambition against the two diseases. As we come towards the end of 2020, we don't know which of the two diseases, COVID-19 or TB, will end up winning the race you don't want either to win, which is which infectious disease has killed most people in the world. It will be fairly close, I imagine, between them. Both will have killed somewhere around 1.5 million people. But when you think about that similarity, what you lose is the differences. The reality is the 6.5 billion a year we are spending on TB is a tiny fraction of what the world is spending on COVID-19. It's not one order of magnitude, it's significantly more than that. If you think about the R&D pipeline, there are some interesting, potentially powerful products, vaccines, therapeutics, treatments in the pipeline for TB, but the reality is it's a handful. There are hundreds in the pipeline for COVID-19. The sheer scale of investment is completely different. And even as we welcome the report, and it's been a huge amount of work to put together this report, and it represents an incredibly valuable fact base from which to base our programs, we should also reflect on the fact that here we are celebrating a report telling us what happened in 2019 in TB, when I can also look at data about what happened yesterday in COVID-19. The investment in data systems and information on COVID-19 is a whole league ahead of where we are on TB. So not only do I think that we cannot let COVID-19 follow the path that TB has taken to be, in a sense, a kind of unfinished fight against a pandemic, but we should also use COVID-19 as a catalyst to raise our ambition, as an impetus to do things differently, to accelerate innovation, to get our data faster, to really leave no one behind on TB as well. Thank you.
Very much, Mr. Sands, on these very important messages. You also mentioned the civil society and their input, so I will call on Ms. Evelyn Kibuchi, who is a TB advocate and member of WHO Civil Society Task Force and Stop TB in Kenya, to give some remarks.
Thank you so much. Ladies and gentlemen, allow me to bring the human face to the figures and statistics that have been referenced by the previous speakers. In June this year, Janet, aged 23 years, was diagnosed with TB, which took 3 months before she was diagnosed. Since her diagnosis, she has never disclosed her illness to the employer due to stigma. She fears she might lose her job if she does. It has therefore been very difficult for her to access a TB medication, and she has to lie to the employer that she's going to get treatment for her mother. She has to come up with a new lie every month so that she can access her own treatment. And what is worse, she has to conceal the drugs when she comes with them, and even when she's taking the drugs. I will not mention anything on how she explains to the employer regarding the malaise, the loss of weight, and other obvious TB symptoms to the employer. Her mother has not made it easy for her because she has refused completely to accept that her daughter could be suffering from TB. She says no one in the family has ever had TB. Her situation only gets worse because she got infected when the world is struggling or is battling with COVID, which further makes it worse, strains access to TB services, and even doubles the stigma that is already existing with TB. Janet's case represents the many challenges that are posed by TB stigma. Janet's case is replicated the world over where TB is prevalent. On the World TB Day of 2007, I remember, I was still a TB advocate then. A Kenyan newspaper, the Daily Nation, carried as an article with the headline, "Stigma, a major barrier to access to TB services." 13 years down the line, this headline would still be relevant. And if you continue conducting business the same way, in 2020, at the end of the UNHLM commitments, the same headline may carry the day. As has been mentioned in the highlights of the report, much as there's some progress that has been reported, we are still way behind the targets in many of the UNHLM commitments. To be on track, in this year, 2020, we needed to be at least halfway all the targets. And the emergency of COVID makes us drop even further off the track unless the following actions are taken. 1, we need to double the effort in everything. We are fighting 2 epidemics which have a lot in common, from transmission to management. Therefore, we have to double our efforts in addressing the 2 epidemics. We have to double the efforts in funding. We have to double the efforts in TB prevention, TB treatment in children, double the efforts in treatment of drug-resistant TB, triple the efforts in treatment of drug-resistant TB in children. We need to double our efforts in investing in research and development for more newer technologies and more effective. To make positive, refreshing headlines in 2022, we must double our efforts, even in political commitment in TB response. And what is the game changer? The game changer will be more involvement of the people who knows where the shoe hurts most. These are the communities and the civil society organizations. These are the foot soldiers who address stigma and violation of human rights that come with it. These are the people who advocate or who will advocate for the increased funding, like we have mentioned, we need more funding from both domestic sources and from the donors. And this is why we really appreciate the World Health Organization for recognizing these roles that are played by communities who are infected and affected by TB, and also the civil society organizations, and creating the civil society task force, whose presence and contributions, since it was created after the Moscow conference, their contribution has been quite immense in TB response. And to achieve our target seamlessly, we must sustain the engagement of civil society and sustain the engagement of the communities infected and affected by TB. That's one of the key interventions that is really required for us to achieve the targets for 2022. Thank you so much.
Very much, Ms. Kibuchi, for this presentation and reminding us of the importance of civil society in fighting TB. We will now open the floor for questions. Please click raise hand if you want to be put in the queue. We will start with Lara Pinheiro from Global, Brazil. Lara, if you hear us, please go ahead.
Hello, good morning. Can you hear me?
Lara,
hello.
We can hear you. We can hear you.
Okay, great. I would like you to comment a little bit, if it's possible, on the situation of Brazil. I understand that we are one of the countries with the highest incident rates of TB, but I didn't quite get where we are regarding the milestones that we are supposed to reach by the next 2 years, actually. Yeah, maybe if you could comment a little bit on that, on what progress we've made also.
Maybe Dr. KASAEVA would like to say something?
Yes, for sure. Colleagues, Brazil is in the list of the high TB burden countries. Is among 30 highest TB burden countries, and according to our latest report, around 96,000 people fell ill with TB last year, and there were 6,700 deaths. And if we will look at the specificity of the situation with TB, it's relatively smaller number of people with the drug-resistant forms. And it means that in compare with other countries, for example, with the Eastern European countries, treatment success rate and completion of treatment should be higher. But surprisingly, we can see for the last 2 years a growth of the TB incidence in Brazil, and it's very concerning. And unfortunately, we must say that Brazil is not yet on track and will not be most likely achieve the 2020 milestones. This is the reality. If you would like to find more information, I would like also to address our app version of the Global TB report. Now it's available in English, French, coming Spanish and Russian. So it's you can very easily find all the essential information about the countries and global situation.
Thank you very much, Dr. KASAEVA. Yes, it's a good idea for everyone who wants to follow information on TB to use this app that can be found on your website. As you said, right now it's in English, French, and Russian, but we will have other languages soon. Just to remind everyone that we have two more experts who are online who may also be called to answer some questions, Dr. Glaziou and Dr. Zignol from WHO. And I understand that Dr. Golden from USAID had to leave, so remaining speakers will try to answer questions. And first one is coming from Shoko from Japanese NHK. Shoko, if you hear us, please go ahead.
Hello there, can you hear me?
Can you just speak a little bit louder?
Yes.
Yes.
Can you hear me, Tarek?
Yes. Now.
Okay, thank you for taking my question. So what was the main reasons that the world succeeded to reduce the incidence? For example, in the report, it says high-level political commitments at global and national levels were delivering results. Can you please elaborate it a little bit more? Thank you.
Maybe Dr. KASAEVA can start, and then Peter and Evelyn, who are online, can also add something if they wish.
Yes, very important questions. Or what are the markers of the success in the countries? We can look at our pathfinder, those who are moving faster than others, and we can identify first. It's definitely a high-level prioritization of the importance of the TB programs in the situation, which were followed by the increased investments from the domestic resources. And also we can see excellent examples in countries like Vietnam of creation of the multi-sectoral high-level review mechanism, because TB is depending on and driven by social determinants, and first of all by poverty, malnutrition, and others. And inclusion and tackling these determinants is becoming essential. Another important thing, of course, dramatic scale up of the access to the modern and fast TB diagnostics and treatment using newly recommended regimens by WHO. Again, we can see examples in the countries like India and Indonesia, which were highest burden countries, but in the same time, they demonstrated the most impressive progress, dramatic increase of access to the, and closing gaps in so-called missing people. And they're the major contributors into the global success towards access. We can see such examples at the social support measures and even direct cash transfers to support patients to complete their treatment, because treatment is still long-lasting. And I've mentioned about the diagnostics. We have tools, we have gene experts which are now used, for example, to also diagnose COVID. And we have network, but it should be expanded. It should not be sufficient. And the countries pathfinders again demonstrate the better examples. Civil society is involved, and they're attracting attention to the most important needs. And if countries are reacting, it brings immediate results. So I will not go into the details. Again, would like to refer you to the report, and maybe colleagues would like to add.
Yes, maybe Peter, would you like to add something on what contributed to successes so far?
Just very briefly, more money, really clear focus on identifying missing cases and getting these people treatment. If you don't find them, you can't treat them, you can't save their lives. Much greater focus on barriers to access, be it stigma or discrimination or other human rights related barriers. And then lastly, as TEREZA said, better tools, better diagnostic instruments, better treatments. Oliver.
Thank you very much, Peter. Evelyn, would you like to add something to this from your perspective?
Yes. One of the things that have been, or one of the progress that has really been seen is realized is the political commitment. And this, for example, has come in the commitment that has demonstrated by members of parliament. We have the parliamentary TB caucus in different countries, where members of parliament has come in to really put their efforts and put their efforts in seeing what they can do within their countries and their regions and the world over to address TB within the mandate that they have in parliament. Secondly, the UNHLM was really a game changer. It really gave a lot of limelight to TB, and that came with its own benefits, for example, creating of more awareness among the citizens of different countries. And that awareness also came with taking action. So we only need to sustain these gains that have been made. We need to sustain these game changers so that we can achieve the 2022 targets. Thank you.
Thank you very much. We will go to the next question. It's a German news agency, DPA, and we have Christian Ulrich online. Christian? Do we have a Christian? If you can unmute yourself, please. I don't.
Hi, sorry, I had my question answered, so I'm withdrawing. Thank you.
Christian, we will go to John Zaracostas, who is writing for Lancet. John, unmute yourself, please.
Yes, good afternoon. Can you hear me? Hello?
Yes, John, we can hear you.
Good. Yes, I'd like to follow up on something Peter mentioned, and maybe the WHO experts can shed some light. With the current COVID-19, what are the data showing? Are you having co-infections of people with COVID-19 and TB? And is that leading to a spike in deaths and serious situations? And I've got to follow up on rapid diagnostics and MDR.
Thank you, John. Maybe we can start with the Dr. Matteo Zignol, who is online, who is working on prevention, care, and innovation. Dr. Zignol, would you like to try to answer this question?
Yeah, sure. So we are monitoring closely the co-infection and TB and COVID. And so far, what we have been seeing in several projects throughout the world is that COVID has a negative effect in patients that have had TB, so patients that have sequelae of TB, and they live with those, and so increases in death among them. In terms of co-infection, it is still unclear. It is very early stage, I would say. But most of the TB patients, of course, are young patients. They are not in the groups of, for example, the elderly that are more at risk for COVID. But clearly, the major effect that we can document now is on patients that former TB patients that have much higher risk of dying for COVID. Over.
Very much, Matteo. John, you had another question on diagnostics?
Yes, that's right. Yes, can you hear me? Can you hear me?
Yes, John, we can hear
yes,
you.
Good. Yes, again, you mentioned the importance of rapid diagnostic kits. How much has they increased in the last year, and how much extra funds will the Global Fund and others earmark to make sure they are dramatically increased globally? And the cost of MDR drugs, how much have they come down in the last year? They have been exorbitantly high, although very effective.
Thank you, John. I think this is a question for Peter. Peter, would you like to take this one?
Yes. We are still largely reliant on molecular diagnostics, particularly the sort of gene expert based for the diagnosis of TB, particularly to identify drug resistant TB. We don't have the equivalent of high quality RDTs that we have, say, in the HIV, or we are now beginning to get in the COVID arena, in anything like scale or availability that we need. And one of the biggest things that could transform the effectiveness of the fight against TB would be access at scale to cheap, high quality RDTs, because that would make finding missing people with TB significantly more effective. In terms of MDR, TB, and treatment costs, the costs have come down. Even more importantly, the efficacy of the latest generation of drugs is significantly better, and the side effects significantly less. The real issue is that we are still not identifying and treating nearly enough of the people with MDR TB. And that has to be one of the critical priorities going forward. Thank you.
Thank you very much, Peter. Next question is from Reuters. I understand we have Kate Calland online. Kate?
Hi. Sorry, there's two of us. There's Catherine and maybe Kate asked the question. Or
Catherine is fine. Please go ahead.
Okay. Sorry, Kate. My question is my question is about the impact of COVID-19 on testing people and tracing them. We'd heard that maybe some contact tracers had been repurposed to COVID-19, and that there had been concerns that some machines had been repurposed away from testing for TB and were being used to test for COVID-19. Is that something that has really happened, or was that just a concern that hasn't really played out?
Thank you, Catherine, and my mistake for mixing up with Kate Calland, with whom we work quite often. She's not even on the call now. Dr. KASAEVA, would you like to answer?
Yes, again, important question. And based on the information we're collecting from the countries on regular basis, and we can see that this is the case. Many countries have reported the use of gene expert machines for COVID testing instead of diagnostic testing for TB. 43 countries, including 13 highest TB burden countries, reported about this. And of course, we are from our side trying to encourage them to test more actively for both diseases instead of repurposing and giving preference only to COVID.
If I could just add, because just to support what TEREZA is saying, this is absolutely happening. And to be fair to governments, the molecular diagnostic machines that are in place for TB are very effective tools for doing COVID testing. So, you know, it's not a bad thing that they're being used. The question is how to do it in a way that doesn't deplete the testing for TB. And so one of the things the Global Fund has been doing has been helping countries buy more machines. The last I looked, we had awarded funds for over 300 extra gene expert machines, but also funding longer shifts, running these machines for longer periods throughout the day, so as to enable them to both be used for COVID testing and, as TEREZA said, to continue to do the vital work of TB diagnosis.
Thank you. I understand, Catherine, you may have a follow-up question. Please go ahead.
Yes, please. Is it possible to quantify that impact, please? For example, you could say something like TB results now take a week longer in Guinea, or identify some of the countries that are having this problem, please. We've been looking for them, but we haven't been able to find countries that at least are admitting having this problem.
I think that you can find these trends in monthly notification of in TB diagnostics, at least in the highest TB burden countries in the report, based on the official information they submitted. And this is exactly the case. Unfortunately, we can see the very clear example in Indonesia, in India and Indonesia. The drop is significant, up to 30% for more than 6 months. A monthly drop in TB notification. Also, the same situation is and probably even both in South Africa. We see Philippines are also reporting, and many other countries. The rate of drop differs from 25%, even in some countries more than 50%. But this is really concerning, and I will repeat, it can lead to the additional up to 400,000 deaths already this year if this tendency will not be stopped.
Thank you very much. And next question comes from RTL. We have Nicole Deno online. Nicole, can you hear us? Hello, do we have a Nicole Deno from RTL online? You may.
Can you hear me now?
Yes, now it's okay. Please go ahead, Nicole.
Apologies. Yes, I have a question for Mr. Sands. You say that we cannot follow the same pattern with COVID-19 as the world has with tuberculosis. Can you spell it out a bit more clearly, please? Is it really so cynical that we must fear, once the Northern Hemisphere has found a way to contain COVID-19, developing countries will be left behind like they have been with TB?
Well, I'm afraid if you look at what happened to two of the biggest pandemics to hit humanity in the last 100 years or so, TB and HIV, both attracted massive public health action and investment to remove them as public health threats in the richer countries of the world. But both diseases are still here and killing millions of people. It's just that the millions of people they are killing are largely in the poorer and more vulnerable and marginalized communities of the world. And there is a lesson there that I think that the world should draw, which is that that's not the right way of doing things. When we fight a pandemic, we should leave no one behind. We should leave no one behind with COVID-19. We should leave no one behind with HIV. We should leave no one behind with TB. And we have done, and we must change that. I have to apologize because I have a board meeting right now, so I am going to have to leave in the safe and accomplished hands of TEREZA and Evelyn. So thank you for allowing me to participate. Thank you.
Very much, Mr. Sands, for your participation, and good luck in your work. We are nearing the end of this press briefing. We have Peter Kenny online, Geneva-based correspondent. Peter, please unmute yourself and go ahead.
Good afternoon, Dr. KASAEVA. I'd like to ask you a question relating to South Africa. You mentioned in your report that actually in 2019 there had been some successes in the fight against TB there. And in view of the fact that there's a high rate of TB and HIV in South Africa, and it also has the highest rate of COVID-19 cases and deaths in South Africa, how do you think this is going to impact the fight against TB in 2020 and 2021? Thank you.
Unfortunately, definitely, there will be impact, and we can already see it. And South Africa is, as I told, is among our high TB and TB/HIV burden countries. But in the same time, in the past years, South Africa demonstrated very strong commitments to fight against TB, and they were very resultative commitments. We can see that due to their pathfinding efforts in the introduction and implementation of the new regime, they've contributed with the data into the update of WHO guidelines. They were one of the major contributors. Also, due to their negotiations with the manufacturers, they advocated for the drop in the price for the treatment, especially of the patients with the drug-resistant TB. And these are excellent examples. And I think that despite of the current situation, and they will manage to mitigate all these risks and provide soonest recovery of the services. They have capacity, they have excellent dedicated community health workers and civil society, and we are here ready together with the partners to provide all necessary support. Impact is severe, but chance to recover and to mitigate the risk is also high.
Thank you very much. I would just like, before we conclude this press briefing, maybe ask Evelina Kibuchi for her final comment. Evelyn.
Thank you so much. My final comments, I want to reiterate on what I've just said, that the engagement of the civil society, the infected and affected communities is very key in addressing the barriers that have held us back from achieving the target. For example, we've mentioned about funding. The civil society are the people who will go knocking doors that the government themselves cannot knock. They are the people who will go doing community education around stigma, supporting people who are seeking TB services, addressing the COVID problem in the communities. Therefore, we need a very strong, empowered body of civil society for us to achieve the targets. And number two, leadership. If we get right at the leadership level, then everything else will follow. That's why I would really urge the heads of state who made the commitments 2 years ago to come back and assess what's the progress that they have made at their country level, and what can they do to address the gaps that we have between now and 2022. Leadership is what will determine everything. Thank you.
Thank you very much, Ms. Kibuchi, for these final remarks. I will ask Dr. KASAEVA also to give her concluding thoughts.
Thank you very much, colleagues, for your attention, for your excellent questions. And in general, for your interest, and I hope that it will help to strengthen awareness among the population about TB. So we should learn definitely the lessons from this current situation with the COVID. And as you could see from our responses and the examples, the previous investments in TB programs now are demonstrating a very important impact in the response to the COVID pandemic. We can see that networks, lab networks, which was built before for the TB programs, now they're actively involved and contributing into the detection of the patients with the COVID. But in the same time, we should continue provision services for our TB patients. And it clearly showed that investments in TB programs are in fact investments into the health systems and strengthening health system. So we have capacity and we should continue combating with diseases. Thinking first of all about the patients and their needs. We are not treating diseases, we are treating people with the numerous hardships, sometimes with several diseases in the same time, and this will be the right and only one possible approach. So I think that we have, despite of very serious challenges and issues, we have still real chances to combat diseases, because we can't afford all the hardships of the people, millions of people, and we cannot look the people suffering and dying from TB, curable, treatable, and preventable disease. Let's remember about this and let's try to do our best. Thank you.
Thank you very much, Dr. KASAEVA. Thank you again, Ms. Kibuchi. Big thanks also to Dr. Glaziou and Dr. Zignol, who were online with us. The press release and the report, link to reports and to supporting documents have just been sent to Global Media List. If you have any further questions, don't hesitate to contact WHO media team. With this, I'm saying you goodbye and wishing you a nice rest of the day.
Thank you.